culture. So that's incredibly good news. I was looking at my Twitter feed inspired by the presentation off stage. Andy Borowitz, the humorist, is the kind of person I follow, and he's got breaking news: Canada bracing for Wisconsin boat people. That's his thing today as we watch the election in Wisconsin. So you can see where my head is when it comes to Twitter. I am pleased now to introduce Bridget Catlin, the Director of County Health Rankings and Roadmaps at the University of Wisconsin Population Health Institute, and Patrick Remington, Associate Dean for Public Health at the University of Wisconsin School of Medicine and Public Health, who will present County Health Rankings and Roadmaps.
Good morning. Thank you. Well, we are from Wisconsin, where an election is happening as I speak. Don't worry, I put in my absentee vote. What I'd like to do is show you the County Health Rankings and Roadmaps webpage. We released our third annual report on April 3rd of this year, showing the rankings. In just a minute, Dr. Catlin will show us about the roadmaps. Let me click on this tab here, showing Learn About Data and Methods, to provide you with a background of the County Health Rankings. And this model is really an important part of our application, in that it simplifies an incredibly complex array of data into a fairly simple model. We consider the health of a county or any place as a composite of the length of life, the mortality rate, and the quality of life, the morbidity rate. Together, these make the health outcome measures of a county, shown in green. But also important are those risk factors in communities, those health factors that make up a healthy place to live and work. Those are made up of health behaviors, things like tobacco use, diet and exercise, clinical care, access and quality of health care. Importantly, social and economic factors, things like education, employment, or child poverty, and the physical or built environment. Together, these can be summed up and measure the health factors of a community. And finally, we know that policies and programs are important, shown here in the red box. We'll talk about that in just a minute. If you'd like, you can click on the rankings methods to see our open source methodology and also download the data. It's free, accessible at the national or at the state level. So let me return to the home page and just take a quick walkthrough of the County Health Rankings results. If I click on Maryland, right next door, what you can see is two things: a list. And this is really the fundamental part of the County Health Rankings, and the one the media and policymakers are so interested in. We rank from healthiest to least healthy the counties in every state. You can see here, Howard County is ranked as the healthiest county in Maryland. You go down to the bottom of the list, 24th out of 24 counties is Baltimore City. So to show you some of these results, let me first show you the map. You can see here in white the healthiest places in Maryland are surrounding us to the north, but the least healthy places in dark green are down in the south and east, including Baltimore City. To show you more about the County Health Rankings, let me click on the healthiest county, Howard County, and you can see a snapshot, a picture of the health. We go from 30,000 feet sort of down to the ground level. And you can see 29 different indicators summarizing the health outcomes, ranked number 1, second best in mortality and first in morbidity, but also the health factors in Howard County, second healthiest in health behavior, first in clinical care, first in social and economic factors, and 13th in measures of the environment. We also include the data, error margins, national benchmarks, and the state reference. If I go back to the map and click on Baltimore City, I can see the snapshot really at the other end of the spectrum in Maryland. Ranked dead last in mortality with the highest rate of premature mortality, over 14,000 years of potential life lost before the age of 75. You can also see the trend map. The good news for Baltimore City is it used to be 18,000, and it appears to be closing the gap between Maryland and the rest of the country. The unfortunate news for the Baltimore City is that the health factors also rank dead last, 23rd in health behaviors, 15th in clinical care, primarily from a large number of primary care physicians in Baltimore City, but dead last again in social and economic factors, 65% single-parent household, 34%, 1 in 3 children living in poverty, and the physical environment, again, dead last. So let's return one more time then to the map and click on Prince George's County. And what you can see here at the top are the various options now. You can see data not just from 2012, but 2011, 2010. You can click here to compare Prince George's counties to other counties, download the data, print the data, or share the data. So let me turn it over to Dr. Catlin to talk about what to do with this data.
Yeah, so we have a lot of data in our website, but what is the point of all this data? What are we really about? Well, we're really about looking for opportunities to improve. And one of the features on the site that we've added this year is called Areas to Explore, and we can click on this and turn it on, and then you can see that it highlights various measures where there really are particular opportunities for Prince George's County to improve in obesity, in uninsurance, in diabetic screening, and also in high school graduation rates. But even knowing that, what next? Well, the county health rankings have shown us what's making places unhealthy, but we have a new project called the Roadmaps Project, which shows people what you can do to make the places where you live healthier places to live, learn, work, and play. And on each data page at the bottom of the screen, there's a whole section on our Roadmaps to Health, where we provide a wide variety of tools to help you. Let's start by building a roadmap. And here we will build a roadmap within the state of Maryland, and you'll see that there are various options. If you're just at the beginning of your journey towards improving your community's health, you probably want to start off by understanding your rankings to start with and exploring ways to improve health. And then possibly you might want to do something like writing an op-ed to engage others in your community. We also have tools for people with different roles in the community. So let's select business or employer. And now we're going to build our roadmap. Hopefully. We had a little internet delay here, and it seems to be hitting me, but we'll try one more time. There we go, phew. What will appear in your roadmap are some guides and tools. For example, there's a data drill down guide that we have that can help you work your way through your snapshot, and if necessary, look at areas of challenge, and if you really need to, go back and look at more data. And I seem to have lost the roadmap. Also on the roadmap, there are other tools. For example, there are tools for businesses, employers, for example. We have a whole section of the website specifically to help each of these members of the community figure out what particular role that they can do in terms of improving health. And again, the site seems to have slowed to a halt, or something is happening. There we go. So we have tools for employers and businesses, what you can do, specific actions, and then specific tools to help you take these steps, working together. Because this is what this is all about. Improving health, we see it as there's a cycle where you see the steps around on the outside, and we've got lots of guidance to help you with each of these steps, whether you're assessing needs and resources, focusing on what's important, choosing effective policies and programs, or acting on what's important. And then, as I said, there are all the different community members. We have tools for them, but at the core of it, what we really are trying to encourage is for people to work together. And so that sounds good, but a lot of us actually don't really know how to do that. And so we've compiled from a lot of different sources a variety of resources to help you work together. And each of these steps in the cycle, we have guidance that looks just like this. So we have the purpose of the step, who to involve, what to do, and then if you scroll down, depending on where you are, if you're just getting started, then we've got preliminary information to help you. You're already in the midst of things, but things are kind of stalling, then you can click on the ACT section and see how to get yourself out of maybe the rut that you've got into. And then there are those communities that are already going great guns, but they really are into just continuous quality improvement, and so then they might want to click on the Improve sign there to see more detailed information about how to work together. So there's a lot of text in our site, and we know that. And so sometimes we realize that you can only read so much, and sometimes, even though technology is wonderful, you actually want to speak to a real person. And we actually have real people available. What you can do is click on the Get Help from the Rankings and Roadmaps team, and you'll come up with an email interface, and you can send us an email, and within 1 business day, we'll get back to you, and then work with you to figure out how best we can help you move from data to action to improving health in your community.
Thank you, Bridget. So interest in the county health rankings has really grown over the last 3 years. We've had over 1.7 million visitors to our website since first launching in 2010. It's really become the annual checkup for each of the nation's 3,000 counties, and I encourage each of you to go to your county where you live and click on it to see how healthy it is and how it compares to other counties in your state. And more importantly, click on the new feature, the roadmaps, to learn how you can join with others to make your county a healthier place so that the easy choices are the healthy choices. Finally, we want to close by acknowledging the Robert Wood Johnson Foundation for their support, the CDC and other national organizations for the data, Forum One and Burness Communications for turning the data into information, and most importantly to our team back in Madison, Wisconsin, without whose support none of this would have been possible. Thank you.